Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about the PSA test, which is a screening test for prostate cancer. In this 5 to 7 minute video, I'm going to describe the PSA test. I'll discuss with you the risks and benefits of the test, and then I will give you advice from the American Cancer Association as well as the American Urologic Association. The truth is that cancer screening tests can be a good idea. By identifying cancer early on, you can not only detect the cancer, but detect the cancer when it's easily and most effectively treated. A normal PSA and a normal digital rectal examination can almost reassure you that it's unlikely that you have prostate cancer. So what is the PSA test? The PSA stands for prostate specific antigen, is a protein that is produced by both cancerous and benign prostatic epithelial cells. A small amount normally enters the bloodstream. However, cancer cells tend to produce more PSA and enters the bloodstream more frequently than non-cancerous or benign prostate epithelial cells. So factors that are important to evaluate your PSA include your age, the size of your prostate gland, how quickly the PSA changes over time, and medications that you may be taking that can affect your PSA. Medications used to shrink the prostate, such as Proscar and Avodart, are known to not only decrease the size of the prostate gland, but also decrease the amount of PSA in your bloodstream. Now, PSA can be elevated, and it is not prostate cancer. There are a number of conditions that can cause an elevation of the PSA that is not associated with a cancer of the prostate gland. The most common of all is benign enlargement of the prostate gland. As the prostate enlarges, it secretes more PSA, and this PSA can be detected with the PSA blood test. Also, prostate inflammation or prostatitis can temporarily elevate the PSA level. Surgical procedures on the prostate or trauma, such as the insertion of a catheter, can also cause an elevation of the prostate. A digital rectal exam or even ejaculation can elevate the prostate gland, although minimally. Therefore, it is recommended that when you have a PSA test, that you refrain from intercourse or ejaculation for 48 hours prior to your procedure. I also point out that only 1 in 4 men with an elevated PSA have prostate cancer. So what are the advantages of PSA testing? By checking your PSA on a regular basis, you have an opportunity to identify prostate cancer when it is confined to the prostate and has not spread to other organs or parts of your body. Early treatment can catch the cancer before it becomes life-threatening or causes serious symptoms. If you have a high risk of prostate cancer, you're even more likely to benefit from PSA testing. So what are the benefits of PSA testing? First, you can detect prostate cancer early. It is a very simple, widely accepted blood test, and it can provide you with a certain amount of reassurance, either that you don't have prostate cancer or that you do have it and you can now effectively treat it. It is more likely to be cured if it is diagnosed early or in its earlier stages before it has spread beyond the prostate gland. Also, I point out to you that the number of deaths from prostate cancer has gone down significantly since the PSA test has become available. There are also some reasons to consider for not testing the PSA. Many cancers are very slow growing and never spread beyond the prostate gland. Unfortunately, the PSA can't tell the difference between prostate cancer and non-cancerous prostate conditions such as benign enlargement of the prostate gland. Also, treatment for prostate cancer, it can be associated with serious risks and side effects such as erectile dysfunction or impotence and urinary incontinence. Now let's look at the risk factors associated with prostate cancer. First of all, there is age. The older a man becomes, the more likely he is to develop prostate cancer. Most prostate cancer is found in men over the age of 60 to 65 years of age and older. Also, the ethnic background. African American men have a slightly increased risk of prostate cancer. And then there's the family history. If you have a father, an uncle, a brother, or cousin with prostate cancer, you are at a higher risk of prostate cancer, and you probably should be tested earlier. So what are the advice from the experts, such as the American Urologic Association? They suggest that if you expect to live an additional 10 years, that you have a baseline PSA test around the age between 40 and 50. If the PSA is less than 1, then you can probably start testing every other year instead of every other year. You could begin testing every other year instead of every year. The American Cancer Society recommends that doctors have a discussion with men who are at average risk of prostate cancer beginning around age 50. And that discussion should begin around age 45 for men who are at high risk and age 40 for men who are at very high risk. Both of these organizations recommend no further PSA testing in men with a life expectancy less than 10 years or in men who are more than 75 years of age. So what's my take-home message on PSA testing? PSA testing identifies prostate cancer that needs treatment early before it has spread beyond the confines of the prostate gland. It's a good idea for you to get tested early if you are at an increased risk of prostate cancer. I would suggest that you weigh the pros and the cons of screening, which include your age, your general health, and risk factors with your physician. I suggest that you talk to your doctor, and together the two of you can make the right decision. I hope you have found this video useful on screening for prostate cancer using the PSA test. If you have any additional questions, I would like to refer you to my website, www.neilbaum.com, or you can contact my office at 504-891-8454. Thank you.